properly and will not be functioning. And even at that time too, the fellow may require what we call a renal replacement therapy. So the two have different presentation, but at the end of the day, they also have they share similar presentation when they are advanced. So the kidney disease is called a silent killer because particularly the chronic renal failure, the one that's occurred gradually, is the one that normally refers to as silent killer. If it is due to the one that is due to abrupt kidney injury, that one is usually the fellow is sick or the fellow is having a medical challenges also. So that's everybody will have known that this fellow is sick. But the chronic one is the one that occurred as on a gradual basis. Maybe somebody has a background kidney injury that is not too evident, like maybe blood pressure or diabetes, or somebody that has an obstructive problem. So the thing will have been ongoing without showing any form of manifestation. In most instances, when the kidney starts manifesting with its symptoms, then it means the kidney damage has already advanced. Most of the time, 90% of the kidney functions is already lost. So at that level, that's when you start seeing some of the symptoms that will be attributable to kidney disease. In most instances, except you look out for it, for people that have not developed an obvious kidney injury, kidney problem. So, and some of the common presentation or some of the common ways somebody with with kidney disease could be from just ordinary, today I'm not well, today I'm sick, tomorrow I'm okay, I'm feeling weak, I'm feeling tired. From there, the fellow may start having maybe hiccups, reduction in urine outputs, body swelling, and all sorts of, up to the extent that if nothing is done or appropriate diagnosis is not made, the fellow can go into unconsciousness and may even having seizure and all those things, and from there may die. So it's silent killer because it doesn't show anything at the early phase of the disease progression. And it is a major problem because most people will just believe I'm not sick, I don't have anything, until by the time something starts manifesting, the kidney damage will have already been well advanced, except you look out for some of those things, or except some of these things are picked during routine clinical evaluation. Thank you very much.
Thank you so much, sir. Even though the focus of our conversation today is on prevention, I see that you've talked a lot already about some of the signs and symptoms, and you also, hinted a bit on high blood pressure and diabetes. So we will come back to talking about prevention, which is, asking questions around, what do you think people can do to protect their kidney from failing and all of that. But let's even assume that somebody currently has a high blood pressure or diabetes. What are the smarter steps you think they must take right now to prevent kidney failure?
Yeah. Thank you very much. Let me also state that currently diabetes and high blood pressure are the current leading causes of kidney failure worldwide, including Nigeria inclusive. Those days used to be infectious cases, but of course, in recent times, due to the high prevalence of hypertension and diabetes, kidney failure, the hypertension and diabetes have been the major cause of those of kidney failure now. Now, there are various tests that somebody can do, but before going into tests, the number one thing that one needs to do is to identify people who are hypertensive or have diabetes or even have a risk factors for developing kidney disease. So when you identify this particular group of people, then you can tailor whatever test that you want to do to identify kidney failure at the early phase. Some of those tests could be as simple as testing the urine And even from a physical evaluation, particularly for some people that are obese, which is also when I mean by obese, people who are overweight, who have a large body size. So it could be a risk factor for kidney disease. Or people who have a family history of kidney, maybe the father died of kidney disease or mother or all this. So you need to identify people who are at risk. Then people who actually had diseases that could lead to kidney failure. Now, just like I said, ordinary urine testing is a very, very useful tool to identify early kidney disease. Blood tests to include renal function, the test of kidneys, are also very, very important. There are various tests that you can do. Then, apart from blood testing, which will also include testing for blood sugar, the control of blood sugar, and all the rest, then you can also do scan. Abdominal scan can be done to evaluate the kidney properly. It will identify people who have a maybe congenital problem, maybe during the course of during birth or whatever, they have developed a congenital problem relating to urinogenital system, which may lead in future to renal failure. So ordinary ultrasound could be of great assistance to identify those things, and it could also be of great assistance to even people who are already having a mild renal problem. It will identify, it will assist you to know the degree of damage to the kidney. There are other tests that will be tailored towards the potential causes of renal failure or for somebody who has already developed renal failure. But for community screening, for people who are relatively stable, urinary testing for protein in the urine is a very, very valuable tool to do. Thank you very much.
Thank you so much, Doctor. I like that you're keeping it succinct. And like we say, you're kissing it. Like, keep it simple, sweet, and simple. Thank you so much. We truly appreciate. So now let's talk about taking water. You know, personally, I like to take water a lot. But I also know that the implication of taking a lot of water is that you have to go to the restroom every now and then. So I think that in itself is a major discouragement to people as to why they do not take water. And we know that taking water is important, but I'd like you to please speak to us from a medical perspective. And as far as the kidney is concerned, how important is it for us to take water? And how much water do you think we should take in a day?
Thank you very much. I would like to let us know that in a simple way, our kidney is like a waterway, a water work, sorry. The kidney is is a bag full of tubes, and it works predominantly with water. The kidney requires water to function. In fact, it's so important that 1/4 of the blood flowing through our body goes straight to the kidney. As small as the kidney is, 1/4 of the total blood flowing in our body goes to that kidney because it requires water to function. So now going straight to the question, knowing that kidney is a water work and that requires water every day, we need to take enough water to maintain our kidney in a healthy state. Generally, everybody requires about 2 to 3 liters of water per day. That is just on an average. Now, we all know, when I say 2 to 3 liters, maybe a bottle of pure water, maybe about 3 to 4 bottles of pure water per day. Now, that's to say about 3, if I assume pure water sachet is about 500 mils, so that means about 6 or so of such a thing is required per day for everybody. However, that is a blanket statement. We live in different parts of the country where the weather is different. So for somebody living in the north, where the weather is usually very hot compared to people living in Lagos, where the weather is usually very cold. The daily water requirement will be quite different. For people living in the north, will require the larger volume of water per day compared to people living down south, where the weather is cold. Again, depending on the year, the time of the year, or the weather, sometimes we are in the rainy season where the weather is usually very cold, whether in the north or south. The requirement for water, for daily water, will be quite different from when we are in the dry season, when the sun will be very enervating, and we will tend to lose a lot of water through our body system by sweating and all those. So the water requirement at that level will be different from when we are in the rainy season, where we tend to have cold weather. Now, it will be wrong to say somebody should go and be taking water just because you want your kidney to function well. There's what we call water toxicosis, so intoxication. If you take too much of water, the good thing is, if the kidney is working well and the kidney is not diseased, no matter how the volume of water you take, the kidney will excrete it. And that is the reason why when you take a large volume of water now and you don't have any kidney disease, the next few minutes you go and pee, because the kidney itself regulates the volume of water within our system. So the kidney senses when there's a lot of water in the system, and the way it responds to it is it pushes out that water so that it doesn't retain in our body, so that it doesn't cause body swelling. So the kidney pushes it out. However, if we are not taking enough water, the kidney also automatically readjusts to retain most of the water within ourselves, so that our body will continue to function very well. The problem now is when the kidney is not working well. You now have somebody who is supposed to take enough water, and unfortunately, is not taking enough water. Like I said, the kidney is a water work system. The kidney needs water to function well, and you are not taking enough water. What it means is you are causing more damages to that kidney, more damages to the kidney. So such a fellow will require to be on a maintenance water therapy. However, if it is just an ordinary fellow, you take water to your satisfaction, but it shouldn't be less than 2 to 3 liters per day. I've seen many instances where people will say, oh, they said to prevent kidney disease, oh, you must be taking water. So, and they keep taking water and keep taking water. And unfortunately, they take even to their bedtime. And of course, the kidney in its own function will try to eliminate those water in the body. So definitely the fellow will have to keep waking up to go and pee, so that the kidney will regulate the amount of the water that will be retained within the body. So the general advice is take what we call a liberal water intake. Don't take unnecessarily water, that just because they say kidney work with water, you will not start going to be taking water when it was not even necessary. However, that does not still mean that we should not take water adequately. If you've been since morning, you've not taken much water, after eating, you just take a sip or whatever, and you did not take any water. So it is not too good. You must maintain. You must maintain not taking too much and not taking at all, so that our kidney will be able to function very well, and at the end of the day, will not be causing more damages to ourselves. And a simple way to know all these things is if you check your urine and you see that your urine is very dark, deep yellow color or very dark yellow, you should know that you are not taking enough water. At that instance, you need to take more water. But if you know that you are peeing and you see your urine that is very white, you should know that you have been taking too much water. And that's the reason why the kidney cannot even absorb some of those elements that are necessary. So it's just pushing out the water on its own. So in that case, you have to reduce the water intake. It is just a simple observation that each and every one of us can do without necessarily going to hospital. check your urine, is very, very dark, you should know that. I'm not saying bloody or black, but we all know the color of the urine, and we all know when it is abnormal. And that's when people will call you and tell you that, oh, I have malaria, my urine is very dark, my urine is very this. So it's an indication for us to take more water. Thank you very much.
Thank you so much, Dr. Abolore. I like the way you're breaking this down. You're not just speaking to us medically, but you're also speaking to us as a teacher. And that is really commendable. Thank you so much. Because, before you made the last statement, I was going to ask you, if you're saying don't take a lot of water, and you're also saying, oh, don't do this, how do we understand the balance? But then when you use the urine as an example, I said, yes, this is a teacher. Thank you so much. So personally now, because I am guilty of some things, and personally, I'm also saying to myself, oh, Rafiat, you have to caution yourself, because sometimes I realize that I go to the restroom to pee and my urine is so white, and I'm giving myself a pat on the back. So, oh, well done, your urine is so pure, not knowing that my kidney is saying, oh, take it easy on the water, you're taking too much already. So thank you so much, sir, for being a wonderful teacher so far. And I know that, of course, throughout the end of today's session, you're going to maintain the same energy. Thank you.
Thank you very much.
You're welcome, sir. So yes. I see a few persons just join us. If you just joined, welcome. This is the Sakina Medical Outreach Quarterly Health Talk. Like I said earlier on, this is the third one that we're having for 2025. We had one in Q1 when about nutrition. In Q2, we talked about stroke. And today we're talking about kidney health, looking at prevention and, of course, response. So if you do not know what we've been doing so far at the Sakina Medical Outreach, I would encourage you to go check us out. When I tell you that we do amazing work, I'm not even bragging. I'm not talking about us enough. You need to see for yourself. So please go to our website at www.sakinaaoutreach.org. Sakina is spelled Sakinah. There's an H after the A. And you can also check our social media handles. On Facebook, we are Sakina Medical Outreach. On Instagram, it is a Sakina NGO. On X, formerly Twitter, we are Sakina NGO. And we would like you to support the wonderful work that we're doing at the Sakina Medical Outreach. Like I said earlier on, over 12,000 poor Nigerians are benefited from our healthcare services. And we do all of this for free. It costs a lot of money. It costs a lot of resources to put these things together, and would like you to please support the incredible work that we're doing. Later on, my colleague will put our account details in the chat. Feel free to copy them and give us your widow's mite. And if you don't have it today, it's okay. You can also keep it somewhere else for later when Allah blesses you. Thank you so much for being a part of our incredible work, and we are very appreciative of your kind support. So, Doctor, we'll go to the next question now, because again, water. I know some people who they would boldly tell you, every day, if I never drink Fanta or Coke, carbonated drinks, I don't feel okay. In fact, some people will tell you, I take as much as, 3, 4, 5 bottles in a day. What do you say to people like this? And in their defense, they say, well, I'm still taking water. But please, doctor, talk to us. What do you say to people like this? Maybe some of them are on this call.
Thank you very much, ma. Yes, let me just say this, because it's quite funny, but it's what I see, or what most of us see, or what people too also do. They said we should not be taking too much of carbonated drinks. So instead of taking a whole bottle of Coke, I would rather dilute it so that it will not be as sweet as it is. So they will pour, instead of taking this, they will pour water there and still consume the whole bottle, but it will be diluted, so that it will not give them an impression that, after all, I'm not taking the Coke raw, so I've diluted it with water. But we have forgotten that the same content that is in the whole bottle is what we have already consumed. We only increase the volume of fluid in the Coke or Fanta or whichever one that we have diluted. Let me now go straight to or inform us that, well, the kidney is just an amazing organ that it handles a lot of things at the same time. But however, there's limit to everything, even in life. As a human being, there's a limit to what we can handle. When it's going beyond, then there will be problem. It's like somebody that's been working all days, no time to rest, no time to do anything. Definitely at a time, it becomes so fatigued and may not be able to proceed again. The same thing with our kidney, the way it functions. There are some things that the kidney can handle. It can handle a lot of things at the same time. Particularly some of these chemicals and substances that we take. The kidney will excrete most of those things, extract them, excrete some of those things, and that is dependent on a functional kidney, a kidney that is not diseased. However, if we keep taking all those things, it will get to a time where it will reach a maximum level that the kidney can handle. Then at that point, they will start causing, problem will start coming, small, little. You know, the irony of the whole thing is that the damage does not just occur suddenly, particularly for those one that we call chronic renal failure. That has a gradual onset. However, if it is those substances that can cause problem for the kidney, it may lead to what we call an acute renal injury. And such substances include all those heavily caffeinated energy drinks. Some of them can cause an abrupt cessation of kidney function because they contain a lot of caffeine. So I just bring in this one in line with other carbonated drinks that we take. The simple something is everything acts in nature, everything should be moderated. Things should be moderated. I should not just say that, particularly at a certain age where we have a predisposition to kidney problem. So it should not be at that age that you say that you want to believe that you can take everything and go scot-free. Those things keep increasing the risk of developing kidney disease. You may take 1-2 bottles per day now. You may not have any problem with it, but you know it's a gradual onset. But those ones that can actually struck down the kidney are those heavily carbonated things that I've just mentioned. My advice strictly is that everything should be moderated, whether carbonated drinks, whether carbonated drinks or whatever form. Everything should be moderated because sometimes some of these things could be extended to some of these local concussions that people take. They may turn to be almost having the same function, causing more kidney damages, which I'll still reference later if time permits me. Thank you.
Thank you so much, Dr. Abolore. Of course, you have the time. So please go ahead and talk to us about the ABA mixtures and maybe also incorporate, painkillers, because I know some persons, especially our parents, at the slightest provocation, I mean, more painkiller, and let me have the painkiller, and boom, boom, they've popped it. And even aside painkiller, some persons also abuse paracetamol a lot. Slight headache, when they should be resting, they'll take paracetamol, So please talk to us about all of these things. And we also need to hear about energy drinks. I'm tired. Oh my God, I had a very long day. Go buy me an energy drink. So we see all of these things in our environment and we see people abuse these substances. So please talk to us about herbal mixtures, talk to us about painkillers, paracetamol, and all of that. And of course, include energy drinks. Thank you.
Okay, thank you very much. Just in continuation with where I stopped the other time. All these things that you mentioned, they are called nephrotoxins. They are substances that are toxic to kidneys. They are substances that are toxic to the kidneys. If you look at herbal concoction or herbal preparation in whatever form, majority of this concoction, we don't know the content. I mean, the chemical content of most of those things. And unfortunately, some of those things contain some substances that are toxic to the kidney, which is not known to the consumer. Unfortunately, we're in a country where things are not properly regulated. So everything goes. People sell all sorts of things now, even online. No more all these hawkers that goes around making noise around that. Come and buy this. It can cure all this. It can do this. It can do all that. We have gone beyond that now. People are doing all those things, even online now. People do all those things. So, but there's something, the background is what about even the one that we do in our different homes in form of just prepare this one, catch this one, get this one, mix everything together and start taking it. These are sometimes we go scot-free, or sometimes we are not affected because, or we don't know the impact what we are doing because our kidney is still functioning well, and the kidney is able to handle all those things and excrete them, and that the liver is also doing the same thing, assisting the two working together to remove those toxins and excrete them. It becomes a problem when you now have somebody who has an underlying kidney issues, problem even not known to them because it has not really manifested. So it's like you are trying to cook, you are trying to prepare a fire. Now you gather your stick, gather everything, and now you are adding petrol. You cook, you start the fire quite okay, but the fire is still very indolent. Now you now add petrol to it. The result is known, it will be well known to each and every one of us. So that is exactly how these toxins function. You have somebody who has a background kidney issues that has not really manifested. Now you start taking all this herbal concoction and all those things, and the thing become boom. It become manifest, and that is the beginning of wahala. Just like I said the other time, because of some of these energy drinks are heavily caffeinated, so they cause a lot of kidney damage, and some of them can actually can lead to abrupt short kidney function, which we call acute kidney injury. It has been documented. So we have to do away with some of those things. And in recent time, when I mean recent time, you will see all sorts of marketing all these what they call what do you call it now? Forgetting the supplement and all those stuff. For people who have because they are all as far as me are concerned, they are all classified as herbal preparation. Only that some of them you can actually identify the content. Many of them you can't identify the content, particularly those ones that are produced within our country. All these things people go around and be marketing and be telling people that once you take this thing, it will wash your kidney, it will dissolve kidney stone, it will melt whatever. These are dangerous substances that we are consuming. We've had series of cases of people coming down with renal failure due to some of these substances that we are consuming. It is not only the herbal concoction or what is the preparation that people go around taking, but also some of these religious groups too, preparing some certain substance, certain water or whatever, called whether in form of holy water or whatever they call them, have also been documented to also causes kidney damage because some of the content are toxic to the kidney. I don't want to be mentioning some specific content of those things because this is not strictly a medical forum. So that's why I try to avoid using most of those whatever medical terminology or whatever. They are not necessary. But what are important is we should get the message that some of these things that people go around with, except you know the proper content of those things, that you can identify that this thing contains so. And whatever the content it is, your doctors can tell you that, oh, this is kidney friendly, or this is toxic to the kidney. Don't take it. So except you are able to identify those things, it will be wrong it will be wrong for us to consume anything that comes our way. Now, the other major area that is limited, that is similar to that, which is also a neurotoxin, are the drugs we take, particularly painkillers. It's a common thing in our environment that you just come from work, you just approach a chemist, and they say, oh, I'm tired, so I want to sleep very well. So they gather different types of analgesics, painkillers. They gather them together and you just take them, boom, regularly on a daily basis. These are drugs that even as a doctor, if you want to prescribe, you have to be careful prescribing them. And even you must prescribe them over a very short time and monitor whatever thing you are doing. But unfortunately, because we are living in a loose system where anybody can do anything they like, is it the fault of the fellow going there to buy those things, or the fault of fellow that is selling it, who doesn't know what the implication of what he is selling? It's left for all of us to decide. But the truth is, consuming most of these common painkillers are highly toxic to our kidney. And several times we have had people coming down with kidney problem because of those painkillers that they're taking over a very long time. The other thing is, may not be necessarily maybe because somebody has worked throughout the whole day, but maybe somebody has a chronic leg pain or something that has always been recurrent, or chronic low back pain or whatever. The only thing is, instead of going for proper evaluation, people tend to visit chemists or whatever to go and buy all those painkillers, and they continue to take them. And these are people that we don't know whether they have a background problem with their kidney or not. So these are dangerous things that we have been doing, and people need to stop consuming all these painkiller, so that we will not continue to have increase in kidney failure. The other area, the other one that's also similar to that, which you did not mention, is people using bleaching creams, use of heavy metals, whether in form of a soap or cream or whatever. Some people have bleached their life. It is when they come down with renal failure that will not be telling that, oh, see what you have used your hand to draw to yourself, because you have been trying to become an Oyibo, and in that light, you have been using heavy metals that have been bleaching your skin. And some of these things generates, I don't need to be saying all these things, because the end effect of some of these things is in the kidney. Not like I said the other time, that the kidney removes most of these things. But unfortunately, if this thing has been consistent, it will get a time that the kidney will not be able to do all those things. And it will start, and that will be the time that damages will start. And it will be damaging the kidney silently, without the person knowing. And people will be thinking that, oh, this fellow is doing well, is becoming fairer in complexion, not knowing that it's causing problem for himself. I think if there's any other thing that we need to do, people should avoid taking unnecessary painkiller. People should avoid taking a herbal concoction of something that they cannot really identify the content, and that people should avoid taking heavy carbonated drinks or heavy caffeinated drinks, and we should avoid use of heavy metal in form of either soap, toiletries, or creams or whatever. Thank you very much.
Thank you so much, Doctor. I want to believe that this also includes supplements that people take, especially women. When we say we want glowing skins, and somebody prescribes a vitamin A or vitamin C supplement for us to use.
Yes, you see, I mentioned in passing the supplement. If you can identify the content of those supplements, fine.
Okay.
If you can identify the content of those supplements, and your doctors can advise you that, oh, this is not kidney toxic, or this is acceptable, you can go ahead. But otherwise, just getting all sorts of, I've seen many cases, many instances that people will come to me with some supplements that I will have to stop immediately, because of the content of those things. And again, somebody who has a healthy kidney, if he's taking all sorts of those things, the kidney can assist in removing those things. But if it is persistent, then it will definitely cause problem. The message I'm passing is whatever supplement that we want to take, whatever thing that we want to take, let us get the consent of our physician. Let them certify that, oh, this is okay for your body. This is okay for your kidney. This is okay for your liver. Rather than just blindly taking everything. And when the damages are already done, we'll now be told that, oh, this thing that you have been taking over these years is the one that is responsible for this, your kidney failure. The damage will have been done. Nothing could be done at that level other than to continue with treatment. Thank you.
Thank you so much, Doctor. I still have a few more questions for you, but I think at this point I'd like to hear from our listeners as well. My next question is on food, because I know we've talked a lot about liquid intake, water, carbonated drinks, herbal concoction and all of that. But we've not really talked about solid meals. What do you advise that people take, as a way of taking care of their kidney? But before your response to this question, sir, there's a question loosely related to what I just asked. Ajia Rahmat Egbemi is asking, as one gets old, it is noticed that when certain foods are eaten, maybe for example beans, you feel the excreta is not completely smooth. What is the medical explanation to this? And she has another question as well. She's asking whether the Medical Association of Nigeria cannot meet the policy makers to put all of these loose behaviors in check. Over to you, sir.
Well, the first question, maybe probably is not related to the subject of discussion, but as a doctor generally, we know that as we are aging, so also some of our internal organs are also aging. The way you look at yourself, that you see wrinkling on your face, is also the same reason why, the same thing that will be happening internally. What you can handle 10 years ago, now, after 10 years, you will not be able to handle the same thing. And that's the reason why when you see people that can eat any sort of things when they are very young, as they are growing older, they will not be able to do that because of physiologic changes in our body, which is not due to our making, but because our body is aging. The physiology is changing. So a lot of things can also account for foods not digesting very well. A lot of things will account for that. But in summary, some of these things may be due to the physiology changes that is happening within our body. With regards to medical association handling some of this, I know NMA has been doing a lot of things concerning the use of regulation in terms of all this taking whatever. But I think the Pharmaceutical Society of Nigeria has a lot to do, because they are the one that license some of these chemists and all those stuff. Ordinarily, a pharmacy is supposed to be, when you are meeting a pharmacy is not just dispensing drugs. He also counsel and explain drugs to you. In fact, sometimes you may prescribe some things wrong, maybe inadvertently prescribe some things. If you take it to the pharmacy, if it's a pharmacist, he may write a short note to the doctor that, please kindly check this your prescription. For example, maybe you wanted to write 20 and you mistakenly write 200 or something. If it's a pharmacy that is reviewing that thing, we will definitely call the attention of the attending doctors that kindly check this your prescription. But when you go to chemist, where the fellow that is just selling just know that paracetamol is 10 naira, it is whether you are fit to take it or not, it doesn't concern him, because all that concerns him is you want to make money. So the ministry, the Pharmaceutical Society of Nigeria, the nurses, the medical, everybody has a role to play in terms of regulating some of these things that are being marketed all around. NAFDAC, I know NAFDAC has always been doing a lot too, but I'm not here to assess whether they are doing well or not. But the one that I know that concerns us is some of these chemists that go around selling some things that they are not permitted to sell. But it is the responsibility of the Pharmaceutical Society of Nigeria to regulate them, not the responsibility of the medical association to regulate what some of these athletes push out to so it's unfortunate that we are the one managing the complications of what they were doing. Unfortunately, most of them don't even know the damages they are causing to the so-called customer that they are selling those things to. So we are managing the complication while they are creating more of the problem for us. Now, relating to food, we all need food and we all need to eat because we all need energy. There are some food that are required that we need to take so that it can give us energy, particularly carbohydrates. Now, I will divide the issue of the food or diet. Let me just put it as diet into two. For people who have a background issues, medical issues, the dietary advice is different for somebody who is relatively okay. For people who are diabetic, who have hypertension, who have all those things, generally they have their own dietary modification that you normally tell them. Low this, low carbohydrate, don't take too much of this, don't take too much of that. Now, with respect to kidney disease, for people who already develop kidney disease, usually we tell them not to take too much of protein. Then, whether too much of protein will be injurious to their kidney. However, there is a caveat. For some of them that has this, I'm a little bit going deeper, which I don't think is necessary. Let us just assume that for some of them that already developed kidney injury, they will have to limit their protein intake. The protein intake will be in form of any of the protein. In fact, sometimes at the extreme side, you normally tell them that you should not take anything, any meat, whether red meat or brown meat or whatever. You should avoid taking meat. Cheese and some of these milk products too. They will also be advised not to take them. The other area that we also want them to also control is the food rich in high cholesterol, saturated cholesterol. We also advise them not to take much of those things. Now, generally, people, whether you are stable or not, we tend to advise people that they should not take, they should reduce salt intake. Salt itself, salt should be greatly avoided. Unfortunately, there are many ways that we take salt that we don't know. Most of these bouillon, most of these Maggi or whatever you call them, contain salt. So we tend to add all those things, and we also add ordinary salt to our food. So for people who are hypertensive or diabetic, it is compulsory that they must reduce their salt intake. So also some of these other things that contains maybe cholesterol, this and that, they should limit it. I think I will stop there for now. Thank you.
All right, thank you so much, sir. We have another question here. Adewale A is asking, first off, she says, thank you so much for the lecture. It's been very insightful. So she's asking, what can one do if there is persistent pain and different types of analgesics are being prescribed over a period of time and yet no permanent relief? I'm not sure this is directly linked to the lecture, but I guess she's trying to use a stone to kill two birds. So over to you, sir.
Yeah, it's okay. The problem is if you don't identify the cause of a problem and you are just taking something to relieve the pain, of course, the pain will be persistent. The number one thing that one needs to do is to identify what is the cause of that pain. If you identify the cause of the pain, is it something that will be amenable to medication over a short period, or is it something that may require a long-term medical treatment, or is it something that will require surgical? If it's something that, for example, if it's something that requires surgery, and we keep taking analgesic, thinking that it will go, it will only relieve for a few time, the period that we take it. Once the analgesic wanes off, then the pain will come back again, because we have not really identified what is causing that problem. And that is where the problem normally lies. People keep moving from one area to the other. That I'm having pain here. Okay, they will you go to chemist, they give you painkiller, the thing will go. But you have not solved the cause of that pain. So Most time when we have a pain that is recalcitrant like this, we need to go to the hospital so that the fellow will be properly evaluated and determine what is causing that pain. Thank you.
Thank you so much, Dr. Abolore. Meanwhile, Hadia Rahmat Egwemi is a member of the Advisory Council at the Sakina Medical Outreach. Thank you so much for joining us this morning and afternoon because we started in the morning. Now it's 6 minutes past the hour of 12. So thank you so much, ma'am. You're always here to support us and being a part of what we're doing. So right about now, I will be taking few questions for those who are on this call. I already read out 2 from the chat. If you have questions and you would like to use the microphone, please unmute yourself and ask.
Hello. Hello.
Okay, Mr. Isa Ibrahim, over to you, please.
Thank you very much. Good afternoon.
You're welcome, sir. Good afternoon.
I'm proud to say that I'm a friend to Sakina. Now, thank you very much, Doctor. I want to ask 2 questions. Number 1 is that I want to believe that everybody in their house has 1 or 2 cars being used. And an average car has about 5 tires, 4 and 1 extra. What I'm saying in essence is that what advice can you give to those who donate their kidney? Because if they have only 1 and they donate 1 and the other one has problem, what will be their fate? That is number 1. Number 2 is that you talk about the issue of weather and the issue of the volume of water being taken. Now, what will happen if I go to Western country where we have a kind of cold weather? The water I will take there, will it still be the same thing as the one I will take in Nigeria? Thank you very much.
Thank you, sir. Should I answer?
Yes.
Okay. Thank you very much, sir. I think I will start from your last question. Going to a Western country where the weather is very cold and all the, just like I said the other time, I said averagely we require about 2 to 3 liters of water per day. That's just on average basis. Now, and I also said that we should take water as at when required. It shouldn't be that if you are in a distance, your body requirements will be determined. I mean, the water that you will take will be determined by your body requirements. So it doesn't mean that because they've told you in Nigeria that you must take not less than 3 liters of water in a day. So you now get to where the weather is cold, that you have been peeing, and that you have been you are not really. So you can't say the same volume of water that you want to take there. You only take water when you are thirsty, or you take it what we call a liberal intake. I'm not okay. Let me take this thing. Take water. You don't forget that it's not only water the raw water that we take. The food we eat, there's also water there. The stew and all those things, or fruit drinks that we take, there's also water there. So the average of those things is that take water as at when due, in the form that when your body requires it. If you are thirsty, then you go and take water. Not that you just decided to be taking water and taking water and taking water, that because they say we must take water. So the environment plus your body requirement will determine the quantity of water that you will take. Thank you. Then the first question relating to kidney donation. Number 1, there are a lot of protocols which will be followed before you give before anybody will donate. Nobody will take a kidney will take a kidney of a person that is at risk of developing kidney in the future. They will not take your kidney. Now, let me also state that we all need only 1 kidney to survive in life. For your information, there are some people that are born with only 1 kidney, and they live a normal life, and they may not even know that they have only 1 kidney, until maybe something happened and they were doing a scan and they were doing some tests and all those things, that they will now just suddenly identify that, oh, you have only 1 kidney. So what it means is all of us can survive on 1 good kidney, 1 good functioning kidney. So nobody will go and take a kidney of somebody who is already at a risk of developing kidney problem. Nobody will do that. So again, for somebody that has donated his own kidney, and become also a risk factor. So that fellow too, we also need to be vigilant. We also need to be going for checkup. We also need to avoid some of these things that we are talking, so that it will not knock down the only kidney that he has. It is not when somebody has donated kidney that will not start saying, hey, I want to live a healthy life, or I cannot perform very well, and there's somebody that is selling one concussion and all that, and start taking all those things, or start taking a painkiller, or somebody who is who has a family history of hypertension, even though it has not developed it, start messing up around and not checking up. So all those things are something that the fellow too need to put his eye on. He should not live a reckless life, because the fact that you are, even if he has not even donated a kidney, if you continue to live a reckless life, the kidney, his own kidney too may fail, because he's not immune to kidney failure. So also somebody who donated one kidney is not also immune from kidney failure. So what is important is that whatever form, we should be careful with what we take. We should be careful with taking care of our kidney, whether it is donated or it is not donated. We should be very, very careful. We should be meticulous in taking care of the kidney. Thank you.
Thank you so much, sir. I don't know if we have more questions at this point. Questions? Okay, Mr. Bayo, your hand is raised. Please unmute and speak to us. Mr. Bayo, can you hear me? If you're speaking, we can hear you. Please go ahead and talk. Mr. Bayo.
It's a mistake. I don't have anything to ask. Right on, please.
Okay.
Right on. I don't
Okay, that's fine. Thank you so much. Thank you. Okay, so I don't know if we have more questions. Anyone wants to ask a question? We need to round off now, but I still want to give the benefit of the doubt. So on the count of 5, if there are no more questions, I will take it as we're all good for today's session. So 1, 2, 3, 4, and 5. That's all. Thank you so much, Dr. Abolore, for being very kind, very generous, and very detailed, and for being a fantastic teacher. You know, a lot of times when you listen to medical professionals speak, you get bored because they're speaking medical jargon. And, you know, this is one of the reasons that some of their messages don't really sink, because people are struggling to understand what they're saying. And, you know, when you write, I shouldn't even go to the writing part, because it's always, because it's always a miracle to see a doctor with a fine and legible handwriting. I know that is deliberate. It is also taught in medical school. No wahala. We're okay with that. But really, we want to say thank you so much. And I would like you to just leave our audience with one golden rule for protecting their kidneys for life. If you had to just leave them with one thing to do to ensure their kidneys are protected for life, what would it be?
Thank you very much, and I thank all the audience for participating in this health talk. I appreciate everybody, and I appreciate the Sekina for giving me the opportunity to say all these things, to air my view. This is what we do, and this is what I like to do, because once we have opportunity like this to educate us on the care of our kidney, it means we are trying to reduce the burden of kidney. Let me say that taking care of kidney is extremely, extremely, extremely expensive. Not many people can actually afford the care of kidney, and that is the reason why many times you see all these call for donation every here and there, for maybe for transplant or for sustained dialysis or whatever. We all know that even if it is to be on dialysis, it's very, very expensive to be doing dialysis about 2 or 3 times in a week. So also, if to go for a renal transplant in Nigeria, presently is about 30 to 40 million naira. How many people can cough out such huge amount of money for a procedure? So if we now know that it is extremely difficult to take care of kidney disease in our environment here, then I think whatever that we can do to prevent it occurring, it's worth it. And even if it is for us to be doing it, to be having something like this in different fora, it's worth it, because this is something that is actually preventable. My final message is that the Lord loves the kidney so much. That's why he gave us 2 kidneys. So we should try as much as possible to protect that kidney by, 1, avoiding taking those substances that are toxic to the kidney. 2, for people who have blood pressure, diabetes, or other problems, they should take care of their ailment very well so that they don't end up developing kidney disease. 3, we should try as much as possible to do a routine clinical checkup. We should not just sit down and be telling people that, me, I don't sick, I don't go to hospital. We should at least, even if it's just once in a year, we should approach an hospital, let them do some little routine tests for us, so that if there's any problem, we can identify some of those things at the early phase before it becomes a problem that it will be difficult for us to take care. Thank you very much. I'm very grateful. Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you so much, sir. May Almighty Allah continue to bless, uplift, and enrich you, and may your knowledge continue to serve as, something beneficial to not just humanity. It should also be beneficial to you on the day of Qiyamah. Thank you so much. Before I call on Mr. Kasim Akindumbi, the Executive Secretary of the Sakina Medical Outreach, for a vote of thanks, I want to give a special shout out to Mr. Nasir Abdul Rashid. I don't know if this is a man or a woman because of the Abdul Rashid, or maybe the A after the is oversight. Okay, a man. Because earlier on, I asked people to do a simple game, which is coming up with 3 words from the word kidney, because we wanted to talk about kidneys. So I thought, okay, since we're waiting for more persons to join us, let's play a very simple and short game. And Mr. Nasir did that. So Mr. Nasir, well done. I'm clapping for you. You gave us keen and you also gave us kind. Well done. And thank you so much for participating in that. And I also know that we have more people who joined us. So again, this is Sakina Medical Outreach Quarterly Health Talk. We had one in Q1, another one in Q2, and this is Q3, and inshallah, we're going to have another one in Q4. So far, we have supported over 12,000 poor Nigerians with quality healthcare services for free. And these persons include women, children, men, people with disabilities, and it doesn't even matter whether they are Muslims or not. We do not discriminate. It costs a lot of money. It costs a lot of resources to put all of these things together. And that is why we're banking on your support to help us do so much more for humanity. So if you look at the chart right now, you can already see the account details to pay to. You see it, the Jaiz Bank, Sakina Medical Outreach. Please copy, send us your widow's mite. If you don't have it now, it's okay. You can just keep it somewhere. We pray that God will bless you so that you can bless others. And you should also follow us on our social media platforms. We're going to copy that and put in the chat as well. So thank you so much for always doing this with us. And I look forward to hosting you again, inshallah, in December. So right about now, I'm going to call on Mr. Kasim, the Executive Secretary of the Sakina Medical Outreach, for the vote of thanks.
Good afternoon, everyone. Distinguished participants. As we come to the close of today's enlightening session, It is only fitting that we pause to express our heartfelt appreciation first to Almighty Allah, who granted us life, health, and the opportunity to gather here and also to learn. So, to our esteemed guest speaker, Dr. Adewale A, Abolore, we sincerely thank you for sharing your time, your knowledge, and experience with us. Your insights have shed light on the importance of kidney health and have given us practical guidance we can all take home today. So to our partner, volunteers, and the entire Sakina Medical Outreach team, we recognize your tireless effort in making this program possible. Finally, to all our participants, your presence and active engagement give meaning to what we do. Without you, we cannot be here. We urge you to carry this knowledge into your daily lives, your families, and our communities. Let's share the awareness to people, and that is one of our core focus of Sekina Medical Outreach, because true health begins with awareness and action. Thank you all once again, and we look forward to seeing you at our next quarter health talk, and that will actually happen between October to December. We will surely communicate with you through our newsletter, social media platform. If you have not joined us, kindly follow us on our pages so to get that information, inshallah. May Allah preserve our health and grant healing to those in need. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for attending
Wa-
this quarter health talk. We look forward to see you in our next quarter health talk, inshallah.
Walaikum assalam wa rahmatullahi wa barakatuh. Thank you so much, Mr. Kosim. And with that, we bring this session today to a close. Thank you once again. My name is Rafiat Atunda. I am a hijabi host. So if you have events like this or even physical ones, I'm happy to host them. And I also train on public speaking and building confidence. So if you'd like us to work together, I'll be happy to connect with you through Mr. Kosim and the rest of the Sakina Medical Outreach. Thank you so much and enjoy the rest of the Saturday. Now you can attend your Owambe or just sleep. Bye. Mm.